All right, so we've already talked in another video about what our sit bones are, where they are, and some of the problems that can contribute to sitting bone pain, sit bone pain. Sometimes it just feels like your butt hurts. And so we don't want you to have pain in your butt. So we're gonna talk now about some of the solutions. If you didn't catch that video, go back and watch, because I go over a lot of the anatomy and how there can be this kind of tug-of-war front to back between hamstrings and quads, our core. It all attaches to the pelvis, right? We can have asymmetries left to right, and that torque can contribute to pain there and can interrupt that ability for the pelvic floor to have that shock absorber function that we want to see, and that keeps us from having sit bone pain. So if you're having any pain, like sitting in the bathtub or sitting on a pew or bleacher to watch your kids' sporting games, you don't need to suffer with it. It is fixable. One way you can avoid that from building up is to have good pliability and flexibility, making sure that you're addressing the muscles in the front of the body and hamstrings and things along the back, making sure that when you exercise, you're strengthening in the front and the back. Some of those things can just help you have that good pliability and better symmetry. Also, sitting upright. Again, this is not about posture or slouching. This isn't about your head or neck. This is about not sacral sitting, as we call it, and having the pelvis tucked under. If we kind of curl up on the couch or something and we have that tucked under positioning, it allows the muscles to shorten. And then when you go to be fully upright, whether that's for an exercise or to sit upright, or when you are on a hard surface, you're more likely to experience some of that tension and either feel that sit bone pain, possible pulling on your tailbone, sacral or low back pain, possibly even tension or pain in the hamstring. Those are the most common things that clients report. So staying nice and flexible, making sure you're strengthening both front and back and core, and balancing this postural tension. If you've had pelvic floor tension build up or any other issues like delivering a baby, pregnancies, issues during your cycle, any kind of pelvic or sports injuries to the pelvic area, glutes, hammies, etc., you may already be having quite a bit of pain and need some pelvic physical therapy to address that. You may have great success with traditional physical therapy, but because of those 3 layers of pelvic floor muscle, sometimes that's not always thoroughly addressed. So we're able to go in, check each side of the tailbone, check the structures and ligaments that literally go from that sacrum over to the sit bones and attach directly there, and just make sure that you get a thorough assessment of all of those structures so you can be active and pain-free. If you'd like to learn more about this or have some questions related to suffering with tailbone or sitting bone pain, please visit our website, www.momentoftruthpt.com. We have lots of other blog posts, videos, tons of content there that might be able to help you out, or feel free to give us a call.